Welcome everyone to the Society of Thoracic Surgeons Congenital Heart Surgery Database monthly webinar for August. Today is Tuesday, August the 17th. So thank you everyone for joining today. Just a friendly reminder for your questions, please be sure to submit your questions via the Q&A. We also have the raise hand function enabled. So if you would like to ask your question or if you need to clarify something, please just be sure to use that raise hand function. Do not submit your questions via the chat box. They're hard for us to keep, they're hard for me to keep up with. In the chat box, I'll read all the questions via the Q&A function. If you do use the raise hand function, just be sure that your microphone is enabled so we are able to hear you. Let's go ahead and go over our introductions. On the call with me today from the STS side, we have myself, we have Carol Crone, we have Addie, Emily, we also have Sydney, and I think that's it from the STS side. From our data manager group, we have Chastity and Leslie, and from our IQVIA team, we have Michelle, we have Jean, Joe, Marjorie, and Steve, and I think Melanie will be joining us later if she's able to. So thank you everyone for joining today. As far as our agenda, just going to provide a quick STS update, and then we're going to turn things over to Chastity for her educational session on episode of care, and then she'll give some additional information on the training manual for the future. Then we'll turn things over to Joe for our brief IQVIA update, and then we'll, of course, end the session with our user feedback. If you do have any questions for the support team, please be sure to include your ticket number, your case number, if you have that readily available. And if you do have questions for support, if you wanted to go ahead and submit those questions, if you have your ticket number, include that ticket number, and Jean and her team can start looking into those questions for you. Or look into those issues during the webinar and get back to you, hopefully prior to the Q&A session. All right, so let's go ahead and jump into our STS updates. I don't have a lot of new information for you since our last call. The August training manual has been posted. For those of you who have not had a chance to check that out, that is available out on the STS website. The 2020 harvest analysis update. As stated on our last call, the data is expected to be released late summer 2021. The dashboards, we are currently undergoing UAT testing by STS. And also we are slated to begin our UAT testing, and UAT refers to our user acceptance testing by our core group members, our beta testers, and our surgeon leaders is scheduled to begin this week. So we have reached out. So again, that UAT testing by our core group, beta testers, and surgeon leaders is scheduled to begin this week. Once our UAT is complete, participants will be notified when the data is available within the IQVIA platform. Of course, I can't give you an exact date of when that'll be available. We'll have to work as we go through our UAT testing, so more information will be forthcoming. We will keep you guys up to date. Also, just note, we do have a save the date for Tuesday, September the 7th at 12 p.m. Central Time. IQVIA will be providing an educational session on the risk-adjusted dashboards and the functionality. So again, please save the date for September the 7th at 12 p.m. Central Time. An announcement, a webinar reminder will be provided by our marketing team. So again, just mark your calendar for that educational session on the upcoming risk-adjusted dashboard. Our 2021 harvest update, again, no new information from our last call. The spring harvest close date is still to be determined. But again, that is based on when this 2020 harvest analyses will be released, and you all have had the opportunity to review that data and that analysis. This, again, as I mentioned last time, this will be a topic for our task force call at the end of this month. So more information will be coming on our next monthly webinar after we have discussed the 2021 harvest plan moving forward. So again, more information will be coming to you all after we have our task force call at the end of the month. Just wanted to highlight, just a reminder, I'm sure you all are very aware, our 2021 AQO Data Managers meeting is scheduled for October 12th through the 15th. Emily and her team and the SDS team are working very hard to get everything set and ready for you guys. The congenital session is scheduled for Friday, October the 15th. And just a reminder, with the free registration this year, you all do have access to all of the sessions. So we do encourage you to check out other sessions, other databases, other data days, presentations. If you're interested in learning more about general thoracic, adult cardiac, InterMAX, PDMAX, we do encourage you to check out those sessions as well. A detailed agenda has been posted on the STS website. So that is available. The detailed agenda will be coming soon. The preliminary agenda is posted out on the STS website. So you can find all of your information here out on the AQO page out on the STS website. If you need help navigating to that, I can show you a little bit later in the presentation during the Q&A session how to navigate out towards this page. Again, pricing information is available for those that are not eligible for free registration. If you're not sure if you're eligible for free registration, again, you have to be associated with an active STS database participant and have one of these roles here assigned to your account. If you're not sure of the contacts currently listed for your site, please email us at stsdb@sts.org and we can work with you and get you that information. So again, if you're not sure of the role that you have assigned to your account, or you need more information about the contacts currently listed for your site, please email us at stsdb@sts.org. And also, just to point out, Emily has posted a link to the AQO information page in the chat box. So thank you, Emily, for doing that. And again, if you have any questions related to AQO, please reach out to us. You can email Emily Conrad, econrad@sts.org. And also there is a link on the data managers page to contact Amy for registration questions and Emily to reach out for CEU information as well as content information. So all of that information and contact information can be found out on our AQO data managers page. Next, I'm going to turn things over to Chastity, our STS CHSD consultant, for the education portion of today's webinar. And Chastity is going to provide information for us on episode of care and upcoming changes to the training manual. So with that, I will turn things over to you, Chastity.
Great, thank you, Leanne. So yes, I want to continue our discussion. Last time we ended with a discussion on the operative mortality fields. And so I think that this was a nice segue into then how is the episode of care utilized within the database. And then I just want to touch on a few things coming to the training manual. Probably you'll see most of this right before we go live with our version update next year, but just to kind of give you a heads up of where things are headed. So next slide. Okay, so what is the episode of care? How is it utilized? When does it come into play? So from the most recent, which now seems like it's been a while, analysis report, there is a definition that says an episode of care may encompass a string of 2 or more consecutive hospital admissions when a given patient is readmitted to the same database participant center after discharge to another acute care facility or chronic care facility, but without having been discharged to home or without residing in the chronic care facility for 183 consecutive postoperative days. So while episode of care is not mentioned in our training manual, I think that moving forward, this is something that we can definitely add to the training manual, because episode of care is not a discrete field that we collect data and enter into the database. It's done upon analysis. So it's just understanding what the episode of care is. And so that's why I thought important to bring it here today to discuss. So next slide. So what is then the episode of care? So what we just learned on the previous slide and in the definition is that an episode of care may have multiple dates of admission to the surgical center. You may have multiple operations during any one of these hospitalizations, and you may have multiple dates of hospital discharge. However, an episode of care can only have one index operation and one date of database discharge. Okay, next slide. So how does this get applied than upon the analysis or within our database. So most of the time, as you know, mostly our patients discharge to home after having a cardiac surgery operation. So the episode of care will end at the date of hospital discharge. And this is when your database discharge date matches your hospital discharge date. But complications are really collected through the episode of care. So if a patient were to transfer to another center or a long-term care center, we're still collecting complications as best as we can. The index operation is then assigned to the first cardiac operation of the episode of care. So in the event a patient were to come back to the surgical center and undergo another operation, the index operation remains that initial operation during the initial hospitalization. Mortality is now calculated for the episode of care. So it's not an admission-based mortality calculation any longer, but it is for an episode of care. And then in the analysis report, the length of stay calculations actually use this database discharge date and not the hospital discharge date. So when you're looking at your analysis report, it's, understanding that persons that went to other long-term care facilities or other acute care facilities following discharge from your institution, that the length of stay is actually using this database discharge date, which is the length of stay of your episode of care. Next slide. Okay, so episode of care versus hospitalization, you probably understand this by now, but I thought just important to put it on another slide. Again, the episode of care is the date of hospital admission through the date of database discharge date. And this database discharge date is dependent on your discharge location. So if you discharge home, then your episode of care will end at the time of your hospital discharge. However, if you don't discharge home, then you know that your database discharge date is dependent on meeting the other criteria. Whereas hospitalization is the date of your hospital admission through the date of hospital discharge. And this is irrespective of discharge location. So it doesn't matter where you go following discharge from your hospital, your surgical center, you still have a date of hospital discharge. Okay, next slide. So I want to provide an example of in real life where we might see something like this come into play. So the scenario is following central shunt placement, a patient transfers back to the birthing hospital. They then experience increased oxygen requirements and are readmitted to the surgical hospital. They require a shunt revision before discharge back to that original birthing hospital. But they then return for shunt takedown and bidirectional Glenn procedure. Unfortunately, following their Glenn, they experience a stroke and care is withdrawn. So as you can see in this scenario, this patient has 3 cardiac surgery operations. They had 2 hospitalizations and 1 episode of care. So next slide. So what is the hospital versus the database discharge date? So the first hospital discharge date is the initial transfer to the birth hospital. The second hospital discharge date is the second transfer back to the birthing hospital. And the database discharge date ends up being the date of death of the patient. Next, what is the length of the episode of care? So the episode of care in this scenario is the date of initial hospital admission through the patient's mortality date. So upon analysis, the analyzed postoperative length of stay will be the length of time between the initial surgery and the subsequent mortality date. Next slide. So what is the index operation of the episode of care? So going back to the scenario, you remember, or the definition, that an episode of care, and this is all encompassing of 1 episode of care because the patient never discharged to home, that the index operation is assigned to the first CPB, no CPB cardiovascular operation. And so in this scenario, then this is the central shunt placement that becomes the index operation. Next slide. So what are the applicable complications and which surgery are they assigned to? So the complications that we know that are spelled out in the scenario are the unplanned cardiac reoperation and the stroke that the patient experienced following their Glenn procedure. We do know that there's a potential that there could be an unplanned readmission to the hospital within 30 days of the operation, but because I didn't provide dates in the scenario, we can't say that there is or isn't this because you don't have a 30-day window that you can calculate, but keeping that in the back of our minds. And then assignment of these complications. So upon analysis, the complications will all be assigned to that original index operation of the central shunt placement. Next slide. Okay, so that was it. Oh, sorry.
Hey, Chastity, it's Carol. I have a question.
Are you going to say there are 3 hospitalizations?
No, but we could go back to that slide.
Yeah.
Can we go back to that first slide? So, and it's not anything, it's just for my own, keep going backwards to the scenario slide, please. This one.
Yes.
So let's say in this situation, the patient had a procedure at the birthing hospital,
Mhm.
and then a CPB procedure, a cardiac index operation, CPB cardiovascular procedure, and then they get transferred over to your hospital, hospital B. And then the same scenario, they have a procedure there, they go back to the birthing hospital, they get resent back over to your hospital for another procedure, and then they go back to the birthing hospital, and then the same play out for this patient. So what happens with that first, so at hospital A, the birthing hospital, where they perform the very first CPB cardiovascular procedure, what is for this patient, what is that they would actually have, how are index operations captured at the two hospitals? So what would be captured at hospital A and what will be captured at hospital B?
So you're correct that the hospitals will have overlap, but they will have different index operations and different lengths of the episode of care. So for hospital A, their episode of care will be from their admission through the death that occurs then at hospital B. And their index operation, whatever their initial operation was prior to transfer to me, would be their index operation. Whereas when the patient transfers to me, my episode of care will start at admission to my hospital, and my index operation will then be that central shunt placement. Both hospitals will have their own index operation, and therefore this patient, it's the one scenario in the STS database where a patient can die twice, right? They'll be reported as a death in the original birthing hospital and would be reported as a death in my hospital as well. We would both have the same database discharge date and mortality date. Does that answer your question?
Sense. I appreciate. Oh yeah, big time. I ask questions because I think just a little bit more clarification for myself, so I understand. I really appreciate that, and I see what I get this episode of care thing now. Thank you.
Perfect. And I do want to point out there's a mistake on my slide, and we will get this updated before we post it onto the website. But there are 3 hospitalizations, so 3 operations with 3 hospitalizations, 1 episode of care. So I apologize that the slide says 2. And as I was reading it, I was I think this is 3.
Leanne, you could probably just update it now if you wanted to. Just so Carol. It's on there, so everybody's on the recording.
Oh, Carol.
Carol. Making me go out of PowerPoint view, out of slide presentation view. Cassie, I see Owen has submitted a question. I will get that changed. Owen has submitted a question. I thought, we could go ahead and cover that now since, we're in the middle of this episode of care conversation. Owen says, is there a scenario that a site can have a hospital discharge for the patient when the patient leaves their service, not the hospital, and transfer to a chronic care out of their own hospital? Yes, Owen.
So the rules are the same for institutions that may have like in-house rehab or a chronic care facility. Sometimes it's driven by reimbursement or billing if a patient actually gets a hospital discharge date locally versus not. But yes, if you have a place within your hospital that provides chronic care or rehab and things, so my hospital does have in-house rehab, my patients actually do get a hospital discharge date when they transfer to rehab, and then a readmission date to rehab because it's considered a separate entity for billing purposes. That may not be true in all facilities, but yes, you can put in a hospital discharge date if you have the type of center that has, it's not that you're going to the floor where you'll be a long-term person in acute care, but that you actually have some type of designated long-term care unit, rehab unit. And so I think that you have to look within your institution and see how this is done within your facility. So mine's just driven by billing. It's in the same walls of the hospital and it's owned by my hospital, but by billing purposes, we have to have a hospital discharge date to transfer over to our rehab center. And so if you have questions about how your hospital's set up, we get questions like this all the time to STS or to the core group. And, we kind of take a look at how it works in your hospital, and we can help you navigate that if you have questions. So thank you for your question, Owen. I hope that answered it.
Yep. Yeah. Angie, again, since we're here, do you want to go ahead and answer these questions now, Chastity, or would you rather wait?
Let me do these now before we go into the training
Okay.
manual, so it's fresh. I'm very happy for this.
Okay,
So
perfect.
Angie's question is,
Yep, go ahead.
what if the patient is discharged to home and returns within 30 days of the procedure? Is that considered one episode of care? Where would the complications fall? So Angie, this is a great question and can be a confusing point. So technically, the patient would have 2 episodes of care, because in your scenario, this patient discharged to home. Now, if the patient returns within 30 days of that original procedure and has another procedure or any other complication, pleural effusion that's drained or something of the sort, all of the complications that occur within 30 days of your initial procedure during that first episode of care will get put on that procedure. So the readmission would get put on your original procedure, your reoperation, or perhaps, they come in for an unplanned cardiac cath, or they come in for drainage of a pleural effusion or something like that. All those complications will get put on the original procedure. And because it's within 30 days, if that patient were to die in that second episode of care, it would go back to the initial operation of that first episode of care and that first index operation. So does that answer your question? I think it's confusing because you technically have 2 episodes of care. However, because of the 30 days, everything's going to hit the original operation. Okay, good, Angie, I'm glad. And then Diane, it looks like there is a question from you. Do we follow the date and time of final extubation if they are not transferred? The reason I ask is because my database will not allow me to enter that date because it says it's after the date of hospital discharge. Well, this is great. This came up on a recent core group call, so it's not only you that has this question, other people have submitted it as well. And if you look at the definition of final extubation date and time, it is asking for that date and time during the hospital admission, not the episode of care. So that field is written for the hospitalization. So your software is correctly set up to not allow you to put a date that occurs after hospital discharge. So your final date and time of extubation can't be past your hospital discharge date. And so you are absolutely correct. Now, if on a subsequent readmission within 30 days, a patient is re-intubated, you can still input the complication of that the patient was reintubated for respiratory failure as a complication. It just looks strange because then your final extubation date and time seem like they don't jive with that complication. And so it can be hard to track or keep track of. I like to keep notes within the database if you have a free text field or something to say, hey, patient transferred back in, some complications occurred after the original discharge. Let's see, and then another question. Does that answer your question? Just to make sure that made sense. But in regards to Angie's question, what if after readmission from home, the patient dies at post-op day 31 from the index operation? So the mortality is occurring outside of the 30-day window. So it would not go back to that original case. However, if upon readmission you had another CPB or no CPB operation and it's not just a readmission, then the mortality would be assigned to that case because the death would be in less than 30 days from that case. So all tricky scenarios. And I know we all experience these and they keep us up at night.
Great job, Chastity.
Yeah, awesome. And I updated the slide. There you go.
So we stopped counting. Oh, sorry. Thank you for that. One more question. So we stopped counting complications at post-op day 30. Well, only if the patient discharged to home. So if the patient's still in-house past day 30, you would still collect complications, or if the patient is at long-term care or another acute care facility, then your episode of care is still ongoing. So yes, if the patient discharged to home, then anything that happens after post-op day 30 is no longer attributed to the index operation. And so another question, is that 30 days from OR or 30 days from discharge? So it should be 30 days from your OR, not from discharge. From discharge, the one field that we collect is, was the patient readmitted for any reason within 30 days of hospital discharge? But complications are 30 days from the operative event or your entire length of your entire episode of care.
Hey, Chastity, just to clarify, is that 30 days from OR of the index operation or 30 days following any procedure, even if it's just an operative?
Well, so because we collect complications on, or because we enter as a new record during the episode of care, all surgeries are entered as a new record. You should be collecting complications that pertain to each of those surgeries for 30 days out from that surgery. Yes.
Perfect. Thank you. You're super helpful and smart.
I hope so. Until someone sends me a scenario that makes me not look so smart. All right, so let's move on to the training manual. And if you have more questions, I'm very, very happy to answer those questions for you. So we have heard you. We know that the training manual has some challenges, and I probably don't need to highlight those here, but I'm going to anyway. We know that the training manual is very difficult to search. So we get anywhere from 10 to 20 to 30 questions per month, and we update the training manual with all of those. And I know what it's like then to get in there the next month and go, oh my goodness, I never saw this from 6 months ago, or this and that. So it's difficult to search if new questions have been asked about, maybe a topic that you're looking for. There are challenges to find any of the updates, and sometimes you find them serendipitously later, which has happened to me as well. And of course, we don't have any alignment or consistency with the other databases, so the adult databases of thoracic and adult cardiac databases. And so we know that now is the time to be looking at what we can do to make the training manual work better for everybody. So next slide. So what is going to happen is we're no longer going to post every submitted question. So the questions are often very detailed and very specific to your center or to a specific patient at your center. And that's not necessarily helpful to everyone at all centers. There's likely some piece in the meat of your question, that some detail that is more applicable to everybody else. And so that's really what we're going to focus on, is pulling out that meat and making sure people understand that. So with that, if there is a question that is posed that includes some type of definition update, we'll put that under the intent and clarification. So you may not see your question specifically, but again, if there is some need that we have to provide some intent or clarification to something. So I could think back to, say, arrhythmias, where we said, as long as the bypass cannulas are in place in the OR, don't collect arrhythmias. So that's really an update to the intent or clarification of the definition. And that's where we want to include that. I don't need to post then all the questions that got us there. What about this scenario? What about that scenario? That's very specific to you and your patient and your surgeon, case that happened that day. But it doesn't help everybody else by and large. What everybody else needs to see is really, what is the update or the intent to the definition that I need to be focused on. And so I think doing this, it'll be a big shift for congenital, but I think it will make sense. And so I provided a little bit of an example of a question that we received, and I don't need to read this whole thing to you, but as you can see, they have a patient with a VAD. It was done on CPB, and then they underwent a heart transplant. How do I handle the complications that occurred with that VAD placement? Because there were quite a few. How do I handle those? Because of course, all of these complications are going to be attributed to the index operation, which is the heart transplant that occurred actually after the VAD. And so we provided a very detailed response, back to this person, explaining this scenario. And of course, this is exactly what we put in the training manual. So if you were a data manager trying to figure out how to handle, this would just be under the section of complications. So you have to read essentially every update under complications to see if your question is answered or not. And I know that that's sometimes why we end up with multiple questions asked back to the core group that we've already provided answers to. You can't find the answers. And so we hear that. So next slide. So to pull out the meat of this question, I think what is applicable to all data managers is how do I code complications, or how do we account for complications for procedures that occur prior to the index operation? And the take-home message here is that we don't need to code complications on procedures that occur prior to the index. Instead, code those as pre-op factors where applicable. So for example, the patient is cannulated with a VAD, and while waiting their heart transplant, they experience a stroke. If you were to put a stroke on that VAD operation, it will actually get attributed to the later transplant that occurs. It's just the algorithm for how complications are handled upon analysis. And we don't want that to happen. So instead, what you would do is code the stroke as a preoperative factor to the transplant. And it would not be counted then as a complication. And you only want to count the complications that occur from the transplant on. And so that is the take-home message. So you didn't need, you personally, if you're not the person that asked this question, you didn't need to read that entire question and read the entire answer to get to this. These are 2 sentences instead that clear up, this. Now, if you are the submitter of this question, I do still want, you've correctly submitted this question, and we do still want you to submit your question with full of detail, so that we understand your specific scenario. And we're still going to provide the same kind of detailed response to you. It's just that what hits the training manual will be what is applicable to all of us that are coding, in this example, complications on non-index procedures that occur prior to the index procedure. All right, next slide. And so you can see here is under complications, the intent and clarification. So what already existed prior was complications will overlap, list these separately, blah, blah, blah. And then down at the bottom in the italicized text, you can see I provided some more intent and clarification based on the question that was asked. Oops. Do not code complications on procedure. You're okay. Do not code complications on procedures that occur prior to the index operation, and instead code as pre-op factors where applicable. And so that's what everybody needs to see. And so next step, or next slide. The next step will also be, so in the orange, listing the intent and clarification updates. But then we are also going to come up with a monthly document that gets posted with the new updates to the training manual each month. And this will have a list of all of the intent or clarifications that get updated. So you don't have to go through every field in that entire training manual seeing what was updated from last month. Instead, there'll be this separate document that you can quickly scan and peruse and say, oh, okay, this is what is there. Now the adults do this, and my take from the adult cardiac database is that they really like this document. So it'll be probably in a PDF or Excel document that gets put out there that you'll be able to quickly look and say, oh, look, we provided an update to complications. We provided an update or clarification to arrhythmias that occur in the OR, things like that. And so it'll be a quick glance that you can do it. It'll still all be in the training manual as well. But I think this will decrease the amount of searching that you have to do in the training manual. And the document that gets posted, this separate summary document, if you will, I will keep the other months in there as well. So like, let's say if I put one out in September and then another one out in October, we won't have 12 documents for the year. It'll be one ongoing document that in September, these were the updates. In October, these were the updates. And so you'll always have an ongoing log of what was updated. If there are burning questions that we think are for the greater good of people and that everybody will benefit from them, we will then put those in the training manual. So it's not an we're not going to put your questions in the training manual. But I know, even as a data manager myself, I always look for my questions. Well, I know I submitted this, and however, I don't see my question. And so, just to help kind of get us to that point, I think it was good to talk about it. We're not going to see these changes right now, so you can expect your questions from these next few months to still get put in. We're moving to this, moving forward. So I don't think it would be fair to just switch it in the, middle of a version when we have an anticipated date of rollout next July. So, question?
Ooh, Chastity, it's Carol. Do you want me to show what that FAQ summary document looks like?
Yes, that would be great. I think everybody would like to see that. So while Carol brings that up, I still want to reinforce, send your questions full of detail for your specific patient. We need that information to best answer your question. We will then take the meat of your question and roll it into a nice, summary so that other people can benefit from it. So don't feel like you can't give that detail to us in your questions. We still want that to occur. Go ahead, Carol.
Oh, sure. So this is the adult cardiac page, very similar information as to what's on the congenital. The FAQ summary sheet started, we start a new one with each version. So this is the one that went live in July of 2020. These are the updates. It's posted in PDF for us. However, Chastity wants to do it, I'm sure it will be something similar. These are how the questions are posted. We list them by sequence number, short name, and then what update was made. So if there was an FAQ that was submitted, we kind of generalize that question so it applies across multiple sites, and we'll provide the answer. If there's an update with additional clarification, we'll provide it listed as an update. This is August, and then if you just scroll down on this form, you get to July's, and it goes all the way back through the start of the version through July 2020. It's really easy to search this document, and you can look it up. It's a living document. So say that we made a change to PFTs, the same sequence number back in November of 2020. You can easily just search the short name, and you can see all the changes that were made to that variable, or not changes, but all of the clarifications that were made to that variable throughout the life of the version. So kind of helpful in that way. But this is the document we're talking about, and I'm excited that Chastity is going to be able to provide this for you all. So I'm going to stop there.
Yeah,
Awesome,
it's going to be
Carol,
some
thank
great
you.
changes.
Yep.
All right.
Okay.
Chastity, did you want to continue to answer some of your FAQ or some of your episode of care questions before Joe hops into his, or it's completely up to you?
I think the best thing for these will probably be to submit them as because we're getting into scenarios. What about this? What about that? And so I think best to submit them if they're more clinical. I do see regarding the complication algorithm, could the group consider changing that algorithm to disregard complications on the op types that occur before the index so that centers can correctly record the complications? I don't know the answer to that. This has been a long time way that the complications have been considered. You know, obviously we're all aware of it.
Yeah, that would be something that would have to be discussed by the surgeon leaders if there was a change to an algorithm or the way something's calculated. So that would be a conversation for us to take to another group. So I can most definitely do that. So.
And the last one just pertains specifically to the presentation, so I'm happy to take this one. I was not clear on the database discharge. If a patient has a CPB case and is discharged home after 5 days and then are readmitted for a pleural effusion and it is drained and they go home 3 days later, is the database discharge date after the effusion was drained, or is the database discharge date the day they went home after the CPB case? So just to clarify, your database discharge date is the date the patient transferred or discharged to home after that CPB operation. And so if a patient goes home, your database discharge date does mirror that of your hospital discharge date. The database discharge date would differ from your hospital discharge date if the patient had not gone home, if they had gone to another acute care facility, or if they had gone to a long-term or chronic care facility. But the complication of the pleural effusion has occurred within 30 days of that original index operation. So therefore you would put in your complications, you have a readmission within 30 days of the surgery, and you have a pleural effusion that required drainage. And so you would just have 2 additional complications that go back to that original index case. Okay, will there be headings at the top of the pages so that you don't have to scroll all the way back to the start of the section that you are looking for? Oh, so this must be with the training manual. That's a really good, that's a great suggestion.
We'll have the bookmarks.
Yeah.
We'll have bookmarks within the training manual, so you won't have to scroll. You can just click on the section that you're looking. Yeah, there'll be links and bookmarks within the document. Yeah.
Perfect. Great suggestion. Thank you, Stephanie.
Okay. All right, so let's go ahead and turn things over to Joe, and Joe can give his update for us, and then we can continue moving on with any additional questions that come in.
Sure, thanks. If you want to share your screen.
I need to share my screen, don't I?
Yeah.
Sorry about that. Thank you.
Maybe you don't, because this is not new information today. We're just kind of recapping some of the items that went in on the July 31st update. So this might be something you've seen before, but in case anyone has not, we'll just go through these, starting with the missing variable report, STS 6211. The MVR had been showing the prothrombin complex concentrate 4 dose 3 as missing in the report, even though that field was not active on the case form. That should now be resolved and no longer occur. STS 6343. The MVR has been updated so that it recognizes the missing selection for mortality status at database discharge as a missing variable, in addition to the previous functionality, which used to only flag it as missing if no response was selected. Also with the MVR, STS 6427, the on-demand version variable has been updated so that doesn't get flagged as missing on your report. And STS 6340, the 2 in brackets indication has been removed from the MT365 stat variable. So those are all in effect. And I think there's one more update on the next slide. The primary procedure mismatch report. We did make some updates so that the exception rules, specifically exception rule 1, is being applied properly for the primary procedure mismatch report. All right, and that's everything for me. As usual, if you, as the full list of known issues and enhancements is available to you in the library. So if you do want to see the things that we are working on, that should be available for you there. And as usual, if you have submitted something that we didn't discuss, rest assured that we are looking into it, and we will follow up with you as updates become available. Otherwise, you are welcome to reach out, respond to your ticket, and we can provide updates for you that way as well.
All right, great. Thank you so much, Joe.
Yep.
All right, let's go ahead and tackle the rest of these slides you all are very familiar with. Again, IQVIA support plan, please be sure to include your participant ID, the phone number for tech support, as well as the tech support email address. Let's see here, a list of resources that are available to you out on the STS website. If you are not sure exactly whom you need to contact, of course, you can always feel free to reach out to me directly. My email is ljones@sts.org, and my direct phone is listed here. Database operational questions go to stsdb@sts.org. Of course, those are questions related to the current, if you need a list of the current contacts that are available at your site. If you have questions regarding your participation agreement, etc., again, please reach out to us at stsdb@sts.org. Save the dates, upcoming congenital webinars. As mentioned earlier, on September 7th, we'll have our user group call at 12 p.m. Eastern time. I'm sorry, not 12 p.m. Central. Again, September 7th at 12 p.m. Central for our user group call. And then our next monthly webinar is September 23rd at 12 p.m. Central. So again, please mark your calendars accordingly. And that is all that I have from the STS side and for our updates. Let's see here. Next, we'll just turn things over to you all for open discussion. If you have any questions, again, please submit those via the Q&A. And if you need to, please use the raise hand function, and we will unmute and we can answer your questions and discuss if needed. Let's see here. Questions coming in. Okay, so Marina, I saw you had submitted a question, and you said you had your hand raised. I'm sorry, I did not see that. I do apologize. I did not see that you had your hand raised. Let's see. I've already submitted my specific question via an FAQ and have not received an answer. It seems every time I have a question here, I'm asked to send in an FAQ. So I send an FAQ and I don't receive an answer. Sorry, but this is very frustrating. I understand, Marina. I'm sorry, did not see that you had your hand raised. Let's see here. And I know we have Chastity and the core group are answering questions. When we have our next core group call, let's see here. All right, Hold on, Marina.
The
Hold on,
last
I'm having some
question
issues.
I see, the last question I see submitted from Marina was on August 5th. And it can take up to 30
Okay.
days for a response, especially if it has to be reviewed with the surgeons. Yours looks like a very complicated and long question with a lot of information. So, as you
Mhm.
submit those questions, and it does take time for Chastity and her team to review the questions and get you the right answer.
And in full disclosure, Marina, there were a handful of questions. We had so many questions submitted in the last 2 months that we're keep moving questions to the next month. We're actually going to have a second call here in August because there were a handful of questions we couldn't get to, and 2 of which were my own that I submitted. But we felt that we wanted to give adequate time and adequate discussion regarding them. So we're going to be scheduling another call in August to address these in a timely manner. So if yours may be in that group of questions, because there were about 5 of them left over, and so perhaps it got put there. But we're just getting a large number of questions, and we want everyone's questions to be weighed and discussed and get adequate discussion amongst the core group. So I apologize for that. I know yours is a very detailed question, and I didn't want to answer it here because I think it would need discussion from everybody and the core group, because you're going back to two admissions within 30 days with 2 surgeries with 2 database discharge dates and how that impacts the denominator and things. So I think not best addressed on this call, but best addressed from the core group, and you'll get a good detailed answer.
Yeah, thank you, Marina. Yes, and yes, we have a lot of questions, and we are getting that follow-up call scheduled. So I promise we will get your questions answered, and we will get back to you. Kelly, is the user group call 97 going to include the IQVIA educational session on risk-adjusted dashboard? Yes, ma'am. That call on September the 7th will include the educational session from the IQVIA team, and they will be providing an educational session on the functionality of that risk-adjusted dashboard. So yes, ma'am, Kelly, that will be on that session. Okay. All right. I'm not seeing any additional questions come in. Okay. Owen has a question. Historical records at DCRI being used for research and analysis. Owen, I can get a response for you outside of this call. I'll just need more information, Owen. So I'll follow up with you. If you can shoot me an email after this call, Owen, then I can get your responses for you, okay? No problem. Let's see here. All right, I'm not seeing any additional questions come in. So again, just a reminder, everyone, for our next upcoming webinars, the September 7th, we'll include that educational session from IQVIA surrounding the upcoming risk-adjusted dashboard release. And then our monthly webinar is scheduled for September the 23rd at 12 p.m. Central. So with that, again, not seeing any additional questions come in. So I just wanted to thank everybody for joining me today. Thank you, Chastity, for an excellent presentation. Carol, STS team, IQVIA team, thank you all so much for joining today. I hope you guys have a great rest of the week. If you have any questions or need to speak to me directly, again, my contact information is here. I'm happy to assist as needed. Via September 23rd is a Thursday. Is it supposed to be on the 21st? Sorry, Vera, hold on, let me check. Our next webinar for our next monthly webinar for congenital is Thursday, September the 23rd for our monthly webinar. All right. Again, thank you everyone for joining today. If you have any questions, again, please feel free to reach out to me directly. I hope you guys all have a great rest of the week. Thank you, everyone.
Oh, wait, Leanne, can we check the date on that?
Yes.
The webinar, what one was on the 23rd?
Yes.
I just want to double check to make sure we have it right.
Yep.
Yeah, the CHSD monthly webinars on the 23rd. I think we normally do those on Thursdays, right? That's not a change.
I'll have to go back and look, but I will confirm. And again, I'll send out an update or again, feel free to email me directly, but we do have our next monthly webinar scheduled for Thursday, September the 23rd. Okay.
Yeah, I think yep. So I think the reason we did that is because we were planning to do upgrade walkthroughs
Upgrade.
on the Tuesday
Mhm.
calls. Yeah, so we moved that week's call, the monthly webinar, to the 23rd. It was originally scheduled on the 21st, so we'll have to revisit that and make sure we get our
Okay.
schedule, our things on the calendar, because I don't think we're ready to do any education yet on the upgrade.
Right.
At least I don't think so in September, because we're still finalizing information, but
Okay.
okay.
Yeah,
So yeah,
Carol and I'll
we'll
get together. Yeah, Vera, we'll get Carol and I will get together that, and I'll have an update for you on the September 7th call. So again, I apologize for any of the confusion, but there's just so much going on, and we're trying to get so many webinars and calls in. So Carol and I will revisit, and we'll get back, and I'll have an update on our September 7th call. So sorry for the confusion, everyone. Thank you for pointing that out, Vera. All right, everyone. Thanks for joining. I hope you guys again have a great rest of the week, and we'll follow up with you on our next call on the 7th. Thank you, everyone.
Thank you. Good job, Lynn. Good job, CHSD.
Thanks, guys.
Thanks, guys.
Thanks, Heather.
That's all.